Just to let you know, the session is being recorded. It will be saved to the DSI platform so you can access it later. Okay, so if I'd once again like to welcome all of you to the data policy session. I'll ask the presenters to introduce themselves in a few minutes, and the rest of the people in the session can introduce themselves in the chat. While the presentation is going on, you're more than welcome to also use the chat. When the presentations are over, you will get opportunity to ask questions. And each presenter is going to present for between 5 and 8 minutes. And then the questions would follow. And then the next presenter would also go. I would like us to start by asking Francis Crowley to start from CoData.
Hello, Gifty, and hello, Tanya. It's very nice to join everybody here. I've put just something in the chat just to start the chat off. I hope you use the chat a lot during this session here so that we can have some good interaction, and also that you can interact with one another and you can discuss with one another what you're thinking here. So I'll share my screen. I have a few PowerPoints, apologies for that, but it'll help me keep on track and just say something very briefly here. So I really want to introduce to you firstly CoData and what we're doing at CoData. I also want to say that I'm a member of I chair the International Data Policy Committee for CoData, and I'm also a member of the European Open Science Clouds Future Project and the Research Data Alliances. I'm an ambassador for them for ethics and law. So that's some of my background for you there. I'm coming to you, by the way, today from Leuven in Belgium, which is where my home is. And I really want to say something about a main project that we have together with UNESCO and with others on data policies for health in crisis situations. So I'll just take you through that and just to give you an idea of what we're doing here. So just to say something very briefly about CoData. CoData is located in Paris, France. Its headquarters, like UNESCO, is also located in Paris, France. It's the Committee on Data of the International Science Council. And the International Science Council is an international body that's representative of, let's say, science associations, science academies, scientists around the world. So it's the global representation, if you want, of science. And in CoData, we try to work on data. And the objective of CoData is to help the International Science Council realize its vision of advancing science as a global public good. So we want to see science work for society, work for persons, and work for communities. And CoData does this by promoting international collaboration to advance open science, and open science is a critical framework in which we try to work, and to improve the availability and usability of data in all areas of research. And with the International Data Policy Committee of CoData, we try to support CoData in its mission of promoting effective and appropriate policies for open science, for fair data, and for artificial intelligence with a human-centric approach. And that's critical to us, for us. We really want to keep it focused on persons, on humanities, not focused on data, not focused on AI, but see how data, AI, and science generally can work for the public good, the good of individual persons and society. So why policy? And why should we think about policy when we're talking about data? Well, policy is that area that's concerned with policies that affect the conduct of science and the research enterprise. And we find policy is incredibly important if we want to have really good science and science that's effectively working for society as a whole. So the two aspects of science policy is one, policy gives us objectives and rules for governing the conduct of science. And this includes here data and AI, that's our particular focus. And it also gives us objectives and rules governing the application of science, data and AI, to public policy. And in this case, here, public health policy. So data policy, science policy, and public policy, all of these work together. And with regard to data policy in times of crisis, we've taken on an initiative that we launched last year in Leiden, in the Netherlands, with the World Fair program, which is part of CODATA and part of a European Commission funded project on trying to bring data into an interoperable and shareable formats at a global level. And what we want to do within the data policy in times of crisis is to look at the values and principles that are expressed in UNESCO's recommendation on open science from 2021. And we want to apply those values and principles of open science to the specific needs of scientists, policymakers, and the public in a systematic way that allows for improved preparation, response, and rebuilding in crisis situations. And we take into account all kinds of crisis situations. That includes health emergencies, for example, epidemics or pandemics, natural disasters, for example, earthquakes or floods or fires, and also geopolitical conflicts, for example, the war in Sudan or the war in Ukraine. One thing I want to emphasize that though, all of these crisis situations, health, natural, geopolitical, all of them present health emergencies. And all of them require data, and all of them will require a use of artificial intelligence in order to respond to the situations. So we try to frame this in open science because open science, especially UNESCO, gives us the values and the principles we need to work within in these communities. And the foremost interest here is to ensure a human-centered approach to persons and communities. And we want to re-envision data and AI, not only in terms of metadata, not only in terms of fair data, but, and I think this is particularly important in this conversation within Africa, we want to understand data in situ. That is, we want to understand data at the place where it originates. And we feel that separating data from the place where it originates, from the people, from the communities, from the natural environment within which it resides, impoverishes the data. It reduces the value of the data. It reduces the utility of the data. So it's not only about establishing metadata, but it's also ensuring the ecosystem, the environment, the people, the communities, the societies, the natural environment in which that data is most at home. So we have the following objectives for data policy in times of crisis. And that is to examine the scientific, political, and societal frameworks needed to develop data policy with a view towards addressing crisis situations. And this means considering legal and ethical regulatory requirements for data privacy and the use of personal data, but also looking at the underlying ethical human rights and humanitarian frameworks needed to support data policy during a crisis situation. We need to have access to data, and we need to be able to generate data and analyze data and use data in order to respond to health emergencies. And finally, we need to develop the tools that promote the responsible collection, management, and use of data when generating scientific evidence in crisis situations. And we need to do this before the crisis occur. We need to be prepared. We need to do it during the crisis. We need to be able to respond, and we need to do it after the crisis. We need to rebuild and bring society back to a stable situation. Just one last thing here. So looking forward. So one of the things that we've put in the file sharing box that we have for this meeting today is a draft, and I emphasize it's a draft paper on data policy in times of crisis, a consideration of values, principles, and systems for open science, which comes from the meeting we had just a few weeks ago in Paris at UNESCO on examining the recommendation on open science and how we can adapt that for data policy in crisis situations. And I'd really like to ask everybody here in our small group here to maybe after the meeting, go open up that paper and have a look at it and see if you can make some comments to help us work on it. And maybe you want to join our group and work with us on it as well. And I also wanted to say that we have several initiatives coming up with CoData. One is a CoData RDA working group on data tools, services, and systems for crisis situations. Gifty, I'll just be on a second and I'm going over time. Another is a CoData task group, an RDA working group on AI, large language models, and data ethics for open science governance systems. And finally, we have a course coming up with the FSIC on the role of AI ethics in scientific publications on open science platforms, in particular with regard to having impactful knowledge sharing and social benefit for health. And that's going to be from the 1st to the 3rd of August online. And if you look up the FSIC course online, you will find it there. That's everything. So back to the group, please.
Thank you, Francis. Does anybody have any questions? Please feel free to either put it in the chat or unmute yourselves.
I'd be really interested to see if people here in our discussion group are working on open science, and if they're working on how they can use data or use AI to address crisis situations, or what their thoughts are about that, particularly with regard to health crises or public health crises or epidemics or pandemics.
Okay, thank you, Francis. Any takers?
So what I'll do is, people are so quiet.
There's a question in the chat.
Yeah.
It says,
thank you.
Yeah.
Michelle. Yeah. Michelle, that's really important to us. And this is something we just started to think about and develop. You know, what we've been doing, and it's been a big problem for Africa too, is we've been going around collecting data and collecting big piles, big bunches of data. And then what we do with that data is we curate that data and we make it fair. We make it findable, we make it accessible, we make it interoperable and reusable. And what we're doing is looking at the relationships between data and how that data supports one another. And that way we can get the highest utility out of the data. And data utility is what gives us the value of data. The more we can use data, the more valuable that data is. Now, I think one of the things that we learned, for example, from COVID, was that it was very difficult for people to share data. We thought initially when COVID started in February or March of 2020, there was a lot of enthusiasm around the world where people thought, okay, we're going to go and we're going to share our data. Everybody's going to be very generous and give their data. But in fact, that proved very difficult to happen. And what was difficult was to centralize the data. But I think, and what we've been discussing within CODATA and also within the RDA now, is that this idea of taking the data away from the people, taking away from their situation in which they live, is really taking something away that's of value to the people, but also it's devaluing the data. So it's not only data in relationship to one another that we have to maintain, is we have to maintain the data in relationship to the people. For example, we had a meeting of the Global Association for Genetics Health last week, 2 weeks ago now, in London. And we had a discussion there from somebody in Kenya who presented us with what happened during the Ebola epidemic. And that a lot of the samples were taken out of Liberia, were taken out of other countries in Africa, and they were shipped to Europe and shipped to the US. And of course, a lot of people feel, well, that's terrible. They're taking away things that are private property and of value to the people in Africa, and they're just exploiting the Africans. And that's true. But if you think about it, it's even worse than that. Because what they're doing is when they take the data of Ebola away from the patients in Liberia, away from the communities in Liberia, and they bring it to the UK or they bring it to the US, they also impoverish the data. And the data becomes less meaningful and has less utility. The other thing too is with regard to AI is people feel, also with data, is people feel that they're losing control when they give something away. They no longer have control over the data itself. They no longer have control over how that data is being used or manipulated. And really, probably the best curators of data are the people themselves and the communities themselves. So if we can allow, instead of having the model where we try to come with super large data sets, but rather trust the people and trust the societies in which they live to curate, to own the data themselves, we maintain the richness of the data and also better how we can use it.
Okay. Francis, there are a few comments in the chat, but we're also running out of time. We have to make way for our second presenter. And I would ask you, how can people get in touch with you? If you can put your email or contact information in the chat, that would be very helpful.
Yep.
And we can
So,
always come back to the chat and take some of the questions or read some of the comments when we have a little more room after the second presenter.
Yeah, that's fine. That's fine. So what I did was put in the different projects we have. that I had in the last slide, but I put it there so people can copy it more easily and they have it in their hands. And then I also put my contact information there. And just one more thing, because it was a very good question here on AI,
Okay,
and I don't want to ignore that. And I think it's really essential too. And by the way, we're going to do, we're just starting to do a survey on AI. So if people would like to participate in it, or if they would like to use that survey in their organization or in their country, they can contact us, and then we can participate in a more global, a larger survey. It'll already be very large, but we don't have so many people from Africa. So if you get people from Nigeria or from Kenya or from Zimbabwe or South Africa, wherever, Ethiopia, that would be great to have them involved as well. So I'll stop there. Thank you very much.
thank you so much, Francis. Our second presenter is from the WHO Health Data Collaborative, and Moina, I think if I'm saying your name correctly. Thank you.
Yes, thank you so much, Gifty. And thank you, colleagues. Good morning, good afternoon, good evening. As mentioned, my name is Dr. Moina Kasonde, and I'm here presenting on behalf of the Health Data Collaborative, which you'll hear more about in a few minutes, based at WHO headquarters in Geneva. The topic of my presentation perhaps is slightly misplaced. I admit this is more of a global network than something specifically on data policy, but nonetheless, I'm sure we can have an interesting interaction still. So let me go ahead and share my screen. So I hope you can all see this. And again, I'll just run through this relatively quickly, conscious of time. So the Health Data Collaborative is a multi-stakeholder platform that really aims to align both technical and financial resources towards country-owned strategies. We actually added the sort of advocacy and political resources in there quite recently. But ultimately, the platform doesn't so much provide specific financial or other resources, but we do aim to align the resources that are already existent in many different organizations and across the world. This with a focus on the SDG targets and on communities that are left behind. We all know that 2023 is an important year. It's halfway between, it's halfway to the SDGs of 2030. And we also know that COVID has really thrown us off track. So we're very much focusing on catching up towards reaching those SDG targets, and again, ensuring that no one is left behind. And overall, the HDC has 3 objectives. The first is centered around capacity building. So we try to strengthen country capacity to plan, implement, to monitor and to review progress and standardize processes for data collection, availability, analysis, and use. So we really try to work across the entirety of the data journey, including data collection, data availability, data analysis, and data use. The second objective of the HDC, again, speaks to the alignment agenda. At the moment, we all know that there's a lot of fragmentation, there's a lot of duplication that exists when it comes to health information systems and when it comes to managing healthcare data. So the HDC is really trying to improve efficiency of resources through alignment, again, of both technical and financial investments in health information systems. The HDC very much believes in data for action, and through this, we try to increase the impact of global public goods and tools on country health systems through sharing, learning, and through contextualization of the existence of public goods for the regional and for the country contexts. So again, our focus is on the SDGs and on communities left behind. And the HDC is very much part of a broader ecosystem. We are a UHC 2030 related initiative. And we also work closely with the SDG 3 Global Action Plan, which the Secretariat of which is also hosted at the WHO, to try and align different organizations towards issues pertaining to health information systems, healthcare data, and others. And when you think of the added value of the HDC, and you think looking at the agenda today, there's plenty of similar sort of collaboration platforms that exist across the world. But our specific added value speaks to increasing efficiency for support, We try to be very much context specific. So we realize that every country is different. We cannot have one solution for all. One size certainly does not fit all. So all of our global tools, all of our standards we try as much as possible through our working groups to contextualize these for specific country needs or regional needs. We really want to reduce much of the reporting burden that exists across many countries. We know that many of our frontline healthcare workers spend an enormous amount of time having to report multiple different reports from multiple different donors and partners, etc. So again, the HDC, through collaboration, aims to reduce some of the reporting burden, specifically for frontline healthcare workers. Through our different constituencies, including the civil society constituency, we acknowledge that we are ultimately accountable to civil society, to the people that we serve, and we really try to empower and to engage our civil society colleagues as much as possible. We believe, of course, in health and security for all, creating more timely identification, prevention, and response to public health risks. We try to strengthen and leverage many of our links through data systems and through digital technologies. And we also recognize the expertise that exists in many academic entities and innovators, engaging them constructively in data collection and again, across the life form of the data journey. The HDC approach is really, again, centered around national plans. Many different organizations work in different ways with perhaps some very slightly different sort of accountability mechanisms, etc. And it's important to us that everything that we do keeps countries at the center. So all of our organizations, all of our partners, of which there are approximately 200 organizations and 900 individual members of the HDC, really work together to support the country, supporting the One Health, One M&E framework and way of working. As far as the governance of the HDC, so we have a secretariat, which is currently hosted by the WHO. We also have a stakeholders representatives group, or SRG for short. And the SRG is made up of 13 individual members, which represent the 7 different constituencies of the HDC. We have 7 different technical working groups, and I'll speak a little bit more about them in a few minutes. And all of our members, so about 900 members approximately now, make up what we call our Global Partners Group. So let me speak about the constituencies of the HDC. And we've spoken a lot about data sharing earlier on in this previous presentation. So it was really interesting for me to hear this because, of course, one of the issues that many different countries struggle with is data sharing across the different constituencies, be it across the private sector, public sector, civil society, etc. And the HDC really prides itself in having a diverse number of views, which is crucial to being inclusive and responsive in our approach. So at the moment, we work not just with countries, we also work with the private sector. We work with public institutions, we work with philanthropy, we work with civil society, we work with academia, and of course, we work with the multilateral organizations such as the WHO and the rest of the UN family. And each constituency, of course, brings a very unique added value to the HDC, and I won't go through these in too much detail. We can share the slides after the presentation. But I think we all appreciate that every different constituency really brings much to the table, and no one entity can do it alone. It's really much more powerful when we all work together. So let me quickly touch on the 7 different technical working groups of the HDC. There is a working group on data and digital health governance, which is probably of much interest to the audience here, and recognizing that issues of data governance really are cross-cutting and affects a lot of different entities. There is a working group on routine health information systems, who actually recently, interestingly, have been working on an investment case towards RHIS in different countries, putting forward the case for the need for better investment, be it national or external investment. There is a working group focusing on community data. Another one, which is the most popular and probably the biggest, on digital health and interoperability. We have an interesting working group on CRVS. The recent, or the WHO score to recognizes in many countries, civil registration and vital statistics really remains a significant challenge. And the working group on CRVS is a group of experts really trying to address some of these challenges through the technical expertise. There is a working group on LMIS, and finally, there's a new working group that has just been constituted focusing on GIS, geospatial information systems. So again, we recognize that at the moment, data systems are still fragmented, and the HDC overall, through its governments and through its 3 pillars, aims to streamline many of the current data systems that are in place. And we base our work really on this theory of change. And the theory of change mentions that using our resources, be they political resources, advocacy resources, financial resources, or technical resources, we can ultimately produce an impact which is improving the efficiency and alignment of technical and financial investments in country health information systems through collective action. Our country impact, we're open to all countries. We don't like to differentiate, HDC or non-HDC countries. We're really open to supporting any country who believes in this way of working. Currently, we've been quite active in several countries, mainly in the African region, but also in Nepal, in the Southeast Asian region. And as we move forward, really look forward to expanding our country reach and expanding our country engagement. The principles of country engagement are threefold. The first is by invitation or by selection. So we try as much as possible to be bottom up in our approach as opposed to being top down. We invite countries to participate in our activities. We don't select countries. Often we are opportunistic. We recognize that at certain times there may be perhaps a new policy that has been put in place or something that is going on in a specific country that might be an opportunity for us to create impact. And we are aligned at all levels, be it global, regional, or national, or even subnational. This is some of the feedback that we have gotten from our partners. I know that the Botswana in particular, many of our country partners have been quite positive in their response to what the HDC does. And one approach says, if we didn't have this data, we don't know what we are doing, and we wouldn't know who we are serving, and we wouldn't be able to plan. That comes from some of our colleagues there at the Ministry of Health of Botswana. And more sort of testimonies on really the power of this type of partnership and the power of this type of collaborative platform. So I invite you all to join us. Please do become a member of the HDC. Again, we'll share this presentation afterwards. In the meantime, do feel free to look at our website, healthdatacollaborative.org, and do feel free to get in touch with us. You can email hdcsecretariat@who.int. Welcome, of course, any questions. And in the interest of time, I'll stop there and hand it back to you, Chair. Thank you.
Thank you, Dr. Kasonde. We're opening the floor for questions.
Maybe, Gifty, I just say something if I could. Mwenya, I found your presentation just excellent and really so interesting. And I think this is very important, how we can try, as you try to bring people together to share their data and to communicate together about their data. I think that's fantastic. I really wanted to thank you for this. And I think it's a great initiative. And I hope people follow up with you and connect with you, because it's a really good way of doing things. And maybe eventually you and I can also connect as well, and we can see how we can work with your data and our data policy and see what the connections are there as well. But thank you very much for a wonderful presentation.
Absolutely. Thank you, Francis. I look forward to connecting via email. There's certainly plenty to talk about. I mean, you spoke about data sharing across public and private sectors. COVID really highlighted the need for this. So there's certainly a lot more to talk about. I wish you had more time. Thanks.
I believe we have a little more time. We have about 4 to 5 more minutes. Yeah, let's see if the pool is back. But until the pool is back into the main room, I think we can still have some time to talk. And Dr. Kasonde, you did say to contact, you put the contact information. If you could just quickly put it in the chat so people would have easy access to it, that'd be great.
Let me go ahead and put that in.
You know, Gifty, there was another comment that we didn't address in the chat. Somebody, if I remember correctly, but somebody asked, said one of the things that people had difficulties with, particularly in Africa, but I think everywhere really, is during a crisis situation, and maybe Mwenya could speak to this as well. During a crisis situation or during any situation, really, people are sometimes hesitant to share their data because they don't know what's going to happen to it and whose hands it's going to fall, or what will be done with the data that they've shared. And of course, particularly health data, because we all consider that sensitive data. You know, to talk about my health, or to say I have a health problem, and for people to know I have a health problem sometimes is very, very sensitive and very something that we have a lot of concern with. So, Wendy, is there a way that within your consortium you try to address this kind of concern about individuals sharing their data or communities sharing their data?
Yes, absolutely. A very good question. As mentioned, we do have a working group specifically on data governance, and they really focus on those exact issues. And data governance, as you know, is something that is cross-cutting. So I'll give you a practical example. We just recently came back from Nepal and Malawi, where we were doing some work on CRVS. And we were talking about the importance of data sharing when it comes to civil registration of vital statistics. Often civil registration is a multi-sectorial sort of, it's a multi-sectorial area of work. So you don't just have the Ministry of Health involved, but you also have perhaps the National Registration Bureau, involved, the Home Office and others. So even within government, there's an important need to be able to share that data, let alone outside of government. So again, our working group on data governance just try to address some of these issues, data sharing, data security, etc. We're very particular, as I mentioned, in terms of making sure everybody involved is involved. So by that, I mean, for example, the private sector, as you know, is a big holder of data. I think we often talk about, our little apps, our smartwatches having some of the most important healthcare data, that is around. So we recognize that, and we're trying to address some of these issues through our working group on data governance. I'll also take this opportunity to invite you to an event that we'll be hosting. I should have spoken more about it in my presentation, but on the 18th and 19th of May, there will be a HTC hosted event that will discuss many of these issues around data governance, around the importance of investing in health information systems, and really making the case for the importance of all of this. The last thing I'll say, Francis, is that our working group on routine health information systems is also incorporating an element of public health intelligence in routine health information systems. So trying to broaden that up, again, bringing in very much a multi-sectoral approach to everything that we do. Thanks.
There's a comment or question in the chat. It says, could you please share,
Yes, I just saw that comment. I believe that's Professor Charles from Rwanda. Good afternoon to you, Professor. Yes, I put in my email just up ahead, or the HTC Secretariat email just in the chat. I can put it again, and we'll certainly share slides and materials. Thank you.
When do you have any final words, anything else you'd like to add?
No, I think nothing from me. Perhaps I'll let Francis give you the final words. But for me, it's just an emphasis for the power of collaboration and the power of partnership in all the issues that we're discussing here today. Again, I think no one entity can do it alone. So glad for you to join us and let's work together on this journey. Thanks.
Yeah, Wendy has given us such a good presentation, and it's so important. And I think your coalition is really, that collaboration, the health data collaboration is just so important. So I think people should consider joining with you and thinking about this. And because I think we really have to learn how to share data, but it's not just like we give our data away or something. We have to find ways to do it that's empowers the people that's sharing it as well. And that makes their data more valuable to them because they're sharing it, that they get something back. And I also think we have to, and this is something I want to talk with Millennium maybe offline a bit more about, but how can we come with new models? How can we come with new models of data sharing that people really do feel like it's something good for them and something that they want to do, and make it empowering? So I'll stop there. We have to go back to the main session, I see.
I think just before we go, encouraging the notion of data as a global public good is something that we worth putting on the table as well. It's not your data, my data. We really trying to encourage it as a global public good, especially in these COVID times.
Thank you. Thank you, Dr. Kisande. Thank you, Francis. And thank you all for participating in this session.